Hi, everyone. I have a special guest today. He is a naturopathic doctor, fellow colleague. His name is Dr. Mohammed Mansour, and I am sitting with him here at the Anatara Clinic in San Francisco. Thank you so much, Dr. Mohammed, for being here and agreeing to this, having a chat about naturopathic protocols. And I always learn so much from you. I mean, you're somebody that I look to for advice when I have a difficult patient case. You're just a genius. So thank you so much for agreeing to chat. So Dr. Mohammed, you are a naturopathic doctor. How long have you been a naturopathic doctor for?
Since end of 2014. It's been a minute. Yeah.
It's been a minute. I thought you were going to say 20 years because the amount of knowledge you have, it's
no. I think I would say the knowledge base that I've accrued over the years, it's kind of like you rest on the shoulder of giants, I would say. So there's a lot of people in our field that I could contribute or attribute my knowledge base to, Dr. Paul Anderson, Dr. Virginia Osborne, Dr. Brendan Cochran. There's a lot of people, Dr. Neil Nathan, Dr. Jill Christus. So there's a lot of people who are innovators in our field. And I feel, blessed to have known them and share that knowledge with everybody in our profession. Hopefully more than just our profession and other integrative health fields too.
And you're working with the king of integrative medicine. You're working with an incredible medical doctor, Dr. Avi. He is incredible. And you've only been here for 3 or 4 months, but it seems like the two of you work so well together.
Yeah, I think it's a logical pairing of he has a cardiology background, but definitely in more of the functional space. Especially in the climate of long haulers, post-COVID syndrome, some of the cardiac effects, I feel his expertise is really sorely needed in the field, and also having the lens, like a broader lens of functional medicine and how those modalities apply in a complex post-infectious world that we live in today. So I feel I bring some of the naturopathic foundational things, some of the more innovative aspects to using ozone, and some of the ways we can apply different intravenous nutrients with and without ozone to help combat, we're still in a pandemic. We're still trying to fight something that we don't fully understand yet. And the research is ongoing. It's every day. It's changing, and somebody like Dr. Herskowitz is an important integral part of that to understand it.
Absolutely, and I'm here firsthand. So, for those of you listening, I'm literally here at the clinic getting treatments. I'm going to be getting a treatment right after this podcast. FYI, I had COVID in June, and it the actual virus part of it wasn't bad. It was the aftermath of how it affected my hormones, how it affected my overall neurological function, my brain health, my overall wellness. And I know I had treatments all day yesterday. And this is what I want to talk about on this podcast is some treatments that you as a naturopathic doctor are offering that not a lot of clinics I've visited, and I myself, I'm learning, and I'm going to be taking back to Los Angeles. I'm so thankful to learn about this through you. Can we talk about some of these really interesting IVs that you're doing? We've heard about these products to take orally: resveratrol, polyphenols, CoQ10, plasmapheresis. These are all different types of IV treatments. Some are to drain the blood, filter it out, and put it through ozone and oxygenation, and then get the patient treated. Where did you come up with these modalities, and how effective are these treatments? I mean, I can tell you after just one day, I'm feeling 100 times better, which is huge.
I would say, again, I've worked in several regenerative clinics. I feel the technology we're using with plasma separation and ozonation of the blood ultimately was inspired by EBOO, which is extracorporeal blood ozonation and oxygenation. It's a two-line system whereby the blood is coming out on one end, being filtered through a mechanism, and then ozonated at the same time. So it's continuous. And then that filtered blood and ozonated blood is reintroduced on the other end on the inline. The initial principle of EBOO was not so much to work as many would purport as dialysis or filtration, but more so to increase the surface area of blood to ozone. So more of your blood is exposed to ozone, so thereby you get a higher concentration. And also because it's continuous flow, you don't need as much continuous concentration of ozone. So you could actually use less ozone concentration and get what we call like a stacking effect. So the longer you're exposed to the apparatus, the more of that ozonation occurs, even at a low concentration of ozone. So those treatments are timed. I feel with plasmapheresis, the most recent innovation in some few integrative settings is being a true filtration of the blood. So how do you actually filter things out of the blood that you don't want and return most of the blood back in a safe manner and try to incorporate ozone? So therapeutic apheresis is very well studied. They're using it quite a lot in the hospital setting. It's a pretty intense procedure. It's about 4 to 6 hours. You may have had patients who have come to you after COVID or after autoimmune diseases having done it. And they typically pull out about 2,000 to 3,000 milliliters of plasma.
Wow.
So it's almost, a full revamp of your blood.
I think I pulled out 300 to 600. How much did I pull?
You pulled about 600 milliliters. So to put that in perspective, that's about 25% of what a typical standard treatment would be.
Yes.
In a hospital, you have straight needles. You can't bend. You can't move. In this setting, you can use catheters. There's a little bit more flexibility. We can dial things in, especially with people with sensitive veins. So it can be a challenge, but it's not a deal breaker. So we can work with that, and we can modulate things like flow rate, how much pressure is on the veins. And we're very well equipped to deal with that. The main change between EBOO versus plasma filtration ozonation of blood is that we can pull out some of those acute phase toxins in the plasma portion of the blood, which include histamine, cytokines, and we're doing more and more testing on this because this is the bleeding cutting edge of how can we use ozone, how can we push the envelope.
Right.
But solvents, DDT, glyphosate, other toxicants that are very, very difficult to pull out of the blood, such as perfluorinates or PFAs or the forever chemicals. So these things, nobody knows how to pull out of the blood, and we're in a very inundated toxic world. We don't know how to deal with those things. This may be one of those potential ways to use plasmapheresis in an outpatient setting that's more tolerated. You came back the next day, you're talking to me, so that there's proof of that. But also how to do it more than once, and in a setting of multiple chemical sensitivity or patients who are really debilitated by illness and can't tolerate standard therapeutic apheresis or standard hospital versions of this procedure. So this is where we're dialing it in. And then what to give after that. And, you've mentioned polyphenols like quercetin, EGCG, resveratrol. These have all been purported to be ionophores of zinc, so it helps you absorb zinc better. So it has antiviral potential, especially with COVID.
Yeah.
If you wanted to add something.
No. I this is incredible. I just want to, for those listening is, where are we getting all these toxins from? Like where you mentioned a list of toxins. Where would somebody find these toxins? Like,
Oh, it's in industrialized society, you're talking about plastics,
phthalates.
phthalates, those are in cosmetics. You probably are
Hmm.
more of an expert than I am in that. But you can get it from food, unfortunately, that is wrapped in plastic. The way foods are processed, unfortunately, parabens, PCBs, those things are in certain processes of industrialization, and even skin products particularly, but makeup is a big one that's overlooked. You also have to consider agriculture and where you're getting runoff of pesticides, not just glyphosate, but there's so many others we don't even know about, and that may not be something you're directly exposed to, but it could contaminate the water table, and you're getting that in your municipal water, and those
Yes.
things have far lasting effects. And without short of testing your water source, understanding where you live, your altitude, and what kind of plants and agricultural uses being done around you, you wouldn't know.
Right. Because if
um,
you have, I hear this all the time, and I'm sure you've heard this as well. People travel to places like Italy and they don't have a celiac disease per se,
mhm,
but they can tolerate the gluten over in Europe versus the gluten in the US. And it's because of the way our technology, our farming techniques are, and our
mhm.
technology, and the type of grain that, is infected with certain chemicals. So, it does make a huge difference. And, we do see a massive difference between different populations in Europe and populations in the United States, for example, even in our meat sources and our dairy sources and the hormones, and it goes on and on. So we know we're living in a toxic world, and doing these procedures helps sort of minimize. Would you start everyone, because we know everybody's toxic? 50% of the United States of Americans are at least affected with mold. We know that.
Mhm.
Um, would you recommend everybody start with this and then work their way up in terms of using antioxidant
I
IVs after?
actually, it is a case by case basis. Some people have comorbidities, other illnesses they're dealing with, other
Hmm.
infections, Lyme, Bartonella, mold, other things that deplete their antioxidant reserves to a
Hmm.
point where they can't tolerate any type of oxidative treatment like ozone, even at a low dose. But it really depends on the case, the initial blood work, their nutrient status. Some are malabsorption prone, depending on their gut health, depending on their genetics.
Hmm.
Some are what we call slow excretors. So they
Right.
don't excrete toxins effectively. That's often illustrated in their blood work. And even when we try to run tox panels in their urine and try to see, okay, well, how much mold is in your urine, or how much PCBs or solvents or other things can we really find? Sometimes you don't find much in the urine. They're not excreting it that much. It's not that
Right.
it's not in there. And that can be a genetic component. So everyone needs to be treated in a
Individually.
personalized
Yes, of
way,
course.
because a lot of times we see patients who've tried ozone and it backfired on them. They've
Hmm.
tried NAD and it made them way worse.
Right.
And especially in a toxic environment, those toxins are very detrimental, including heavy metals like cadmium, to the mitochondria.
Right.
So if you don't address those toxins, and then you try to give beneficial nutrients like NAD or even ozone, which does upregulate NAD, and say, oh, I'm just going to try this as
Right.
kind of like a shortcut to give me more energy, they might feel
Worse
worse,
at the beginning.
and they don't understand why. It's because you have all these kinks in the engine, and you're trying to give this really high octane, high quality fuel, but the engine itself is kinked, so it can't move.
Yeah.
So it's just going to make it worse, even though you're trying to give the right nutrients. So that's where really looking at the history, looking at the toxic load, excretion status
Mhm.
of the patient, their genetics, all of that needs to be factored in.
Evaluated, yes.
Yeah.
And we're looking at everybody's jumped on the NAD train. Everybody, we have these pop-up clinics doing IV NAD drips, uh, you know, and you you just explained very clearly that, if you have somebody that hasn't, you know, worked on enhancing their body's ability to detoxify, adding NAD on top of that might actually cause you to feel worse. And a lot of people do end up feeling, um, initially they feel good because they're hydrated, because obviously you're getting a full bag
Mhm.
of saline solution. But days after, we find, people with headaches, and those are the individuals that probably have some sort of slow acetylation and probably need some work done with detoxification. The NAD is now yesterday's Prada, as I,
Yeah.
it's yesterday's news. The new NAD that you discussed with me is something called ethylene blue.
Oh,
Can
methylene blue.
you?
Yeah.
Yes, methylene blue.
Yeah. Yeah.
Sorry.
Yeah, that one is gaining a lot of traction, even in oral versions, troche versions that are being purported on social media, to be used at a low dose setting to promote energy, vitality, anti-aging. It has quite a bit of research for anti-parasitic use, so it's used
Mhm.
for infections like Babesia and Bartonella, very difficult intracellular types of pathogens that are hard to treat with just antibiotics. Um, and it has been gaining some traction for anti-aging because it can upregulate your mitochondria, similar to NAD. Without, from my experience, I haven't seen as
Mhm.
many side effects, and it seems to be a little bit better tolerated if you titrate the dose a little bit more carefully. Um, I find that methylene blue has some promise, but in a complex chronic illness patient, when there's multiple variables, it can be 50-50. It can
Right.
work half the time it doesn't work. It's not a panacea, it's not a silver bullet. It has to be taken in context with other things that regulate the mitochondria. So CoQ10, PQQ, there are other cofactors, D-ribose, a lot of other things that go into mitochondrial health. The person's genetics can play a huge role in that as well. Um, that you can't really rely on any of these things as a monotherapy. It's just
Mhm.
it can be a slippery slope. It's very tantalizing to gravitate to something. It looks blue, it looks weird, it looks a little bit flashy, but you have to take it in context of a greater
Yeah.
therapeutic protocol.
And as naturopathic doctors, we always look at clear, correct, and protect. So we want to clear out the toxins out of the body.
Hmm.
We want to get rid of the parasites, the bacteria, the toxicity, the mold buildup.
Hmm.
And then we want to correct. We want to correct the amount of good bacteria in the gut to protect the gut lining. We know our gut lining is only one cell, very, very thin wall.
Hmm.
Clear, correct, protect. We want to protect our intestinal mucosa and keep that strong. So I think those are the major things that we do as naturopathic doctors in order to support our immune processes, and then all the things we do on top, like NAD, even glutathione, even any of these polyphenol drips, this resveratrol, they all add as icing on the cake, per se.
Exactly. I feel that in certain situations, patients are burning through their reserves of cofactors, like some of the
Mhm.
ones you mentioned, faster. So with mold, you notoriously burn through your antioxidant reserves much quicker. It has a pretty big toll on your adrenals, hence the
Mhm.
fatigue, the brain fog, the inability to function for a lot of folks. So they need more vitamin C because your adrenals are one of those critical organs that need a lot of vitamin C, but they also respond really well to polyphenol support like resveratrol and quercetin and EGCG, which even has some antifungal effects. So giving those up front is actually better. Even as a patient needs to do things like binders and try to
Mhm.
remove those toxins. So sometimes you need more. Even though in the common scheme of toxicity in environmental medicine, less is more. So generally doing
Mhm.
less is better. In some instances, patients do need more of certain antioxidants to be able to tolerate even detoxification, opening up your lymphatics, your drainage pathways, what a lot of doctors call pre-tox, or opening up just the pathways of elimination so that you can tolerate things like glutathione, which a lot of patients don't tolerate. So it's like there can be a lot of background prep that's required before you can actually start pulling things out, giving your cells the right cofactors it needs to be less oxidative, to be less in a cell danger response, less in a response where your mitochondria are just shut down, so therefore none of your cells work, you have no energy, you can't utilize any of your nutrients, and you're basically in hibernation mode. So the discussion is complex. It's still evolving, especially with COVID. It does impact your mitochondria, similar to toxins, especially the spike proteins effects. But it's not impossible to see the light at the end of the tunnel.
Absolutely. Yeah. And here at the Anatara Clinic, I know you've only been here short 4 months, but it's an incredible clinic. It offers, the main thing it offers, which for me is magic, is chronic illness. That's a population that's been completely left out. The only 2 places you have to go is to your doctor's office, your conventional medical doctor's office. You have 4 minutes to tell them what's wrong with you, and they write a prescription to get you out of the room. Or you go to emergency, you have an emergency situation, and you might be sitting there for 6 to 14 hours, until you get looked at. People will come here with chronic illnesses, anywhere from chronic fatigue, long COVID, cancers, debilitating conditions. What kind of conditions as a naturopathic doctor are you seeing here at Anatara Clinic?
I think based on the current climate, it's fair to say a lot of long haulers or post-COVID syndrome manifested in a myriad of ways. It could be neurological, it could be musculoskeletal. We've had quite a bit of success using the plasma filtration procedure with ozone. And I think vaccine injury is another big one. Less talked about, a little bit controversial there on some fronts. But we've had quite a bit of success with that as well. We're seeing a lot more cancer incidents in the past 10 years. I think it's become from 1 in 3 to 1 in 2 people are at risk for cancer now. The statistics are pretty staggering.
Wow, that's pretty high. I don't think I've ever heard that.
Yeah, it's pretty significant now in terms of your risk for developing it. And then the data will show after this, this pandemic is evolving, what those rates are going to be like pre versus post COVID. I think the jury's still out and the data is still being accrued, but it's a little bit overwhelming. But ultimately, there are those foundations of health, alleviating the obstacles to cure, alleviating the toxins, finding where the patient's at immunologically, genetically, and working with that that canvas, and then you build on that.
I love that. And we're not doom and gloom. The key is to be aware, and the key is to get the right care. And it seems like this clinic has all the answers to, I know you look at lab tests, and that's the one thing as naturopathic doctors I love that we do, is we really, and Dr. Avi is really great at it as well. He functions very much like a naturopathic doctor in a way where he really looks at lab tests and really looks at reference ranges, because the reference ranges that are on those lab tests are really for athletes and men. They kind of rule out women and children, which are majority of the population, and really important. And you look at the markers of the, for example, TSH, thyroid stimulating hormone. The markers are absurd. They're 0.35 to about 5, and anything above 2.2, as we know, is a subclinical hypothyroid condition. And even we look at ferritin levels. Ferritin levels are between 10 and 300. So if you're the optimal level is like, if you're 10, you're fine. In terms out of a ferritin, your conventional medical doctor will say, okay, you're fine. But if you're 8, you're severely anemic.
Yeah.
So it's, for people listening with iron deficiency anemia, it's one of the most common deficiencies. A
Mhm.
lot of people are deficient in iron. And, it works with so many biochemical reactions in our body. So the conventional medical model has failed. The system is broken. And, we need more places like this where we have a medical doctor and a naturopathic doctor. Can you imagine the day we have clinics like this all over the world? I can imagine, people would be in such optimal health and well-being. What do you think would happen if we had clinics like this everywhere? I think the
Well,
drug companies would be out of business.
well, yeah, I feel, we're trying to help people.
Yeah.
I think the goal is integration and systems based approach to medicine. I think that is the future.
Yes.
They are trying to algorithmic it, so make it into algorithms and make it into an AI based system.
Right.
If
I see
this,
that.
then give this. If this, can give
Yes,
that.
yes, yes, yes.
And it's not that easy with
No.
toxins, with environmental medicine, with
Mm-mm.
mitochondrial dysfunction.
It's not a one size fits all medicine.
No, it's not. And that's the allure of conventional medicine, is like, just give me something simple, just give me a pill. But I feel our center is beyond that. It's at a point where we understand that's not a quick fix.
Right.
And even if it was something like that, that's only temporary, and that's not something that's going to get you over the hump long term. So there is a place and a time for pharmaceuticals. There's nothing inherently good or bad about them. It's how they're used. It's the appropriateness. And of course, lab ranges are not, as you mentioned, standardized for different ethnicities, different sexes, male versus female, but even different places in the world. They've even noticed that for kidney function, now they are forced to use different ranges for African American versus
Right.
others. So it's a slow wheel of, like, what they would call justice in terms of how the conventional realm adapts. We're just trying to push it, so we're not waiting another 20 years before, oh, here's what we would do for, post COVID, or what we would do for post viral illness. We're trying to be ahead of the pack. And unfortunately, there, that has its pros and cons. Not everyone can have access to that, but hopefully the more we get the word out there, the more practitioners like yourself and others can incorporate some of the things we do. It does become more talked about, and it generates discussion, and it generates the right research and the right funding to do this on a national, international scale.
And I think the key is that everybody has the ability to choose what they eat and to listen to their body, and to know that the body has an innate ability to heal itself if given the right environment. So I want to end there and thank our very special guest, Dr. Mohammed Mansour from the
Thank you.
Anatara Clinic, naturopathic doctor extraordinaire. Thank you for being with us today at Healthy Doc, and stay tuned. We'll get you in for more discussions with NAD.
Thank you. Thank you.